Canine hip dysplasia. Dys, meaning abnormal or difficulty. Plasia is a suffix that means to develop or form. There is a deformity of the hip during growth, resulting in looseness and degenerative joint disease, DJD, or osteoarthritis. Most dog owners have heard the term hip dysplasia and know it is attached to dollar signs, but don't actually know where it comes from or if it can be prevented. Early detection of joint laxity is critical to avoiding cartilage injury development. In dogs, hip dysplasia may cause muscle atrophy, especially in the coxifemoral. This occurs because discomfort and instability in the hip joint cause dogs to utilize their muscles less, resulting in a reduction in muscle mass and strength. The pectineus muscle, which helps to stabilize the hip joint, is often affected. The hip joint, which is also known as the coxifemoral joint, is a ball and socket joint. During a dog's development period, both the femoral head, the ball at the top of the femur or thigh bone, and the acetabulum, the socket in the pelvis, must develop at the same time. When there is a difference in this growth, it might result in joint laxity. This lack of consistent growth is often seen throughout puppyhood, a vital stage for skeletal growth. Noticeable symptoms may be limping, trembling, or weakness signs of discomfort in the posterior limbs. If the dog is unstable and is hesitant to stand from a seated or recumbent position, are they hesitant when climbing stairs? These indications could appear in pups as early as a few months old, but are most common in dogs between 1 and 2 years old. A ventrodorsal hip extended radiograph can be used to diagnose. To position a dog, they place it in dorsal recumbency, on its back, with its hind legs fully extended caudally, towards the tail, ensuring the femurs are parallel to each other and the table, and internally rotating the stifles to center the patellas over the femoral shafts. Deep sedation or anesthesia is usually needed to relax. Pet hip distraction radiograph is a technology that assesses the real degree of hip laxity by placing a distraction force on the hip joint. It works especially well for early detection among younger dogs. Compression radiographs is like pen hip, except instead of distraction, a compressive force is applied to the hip joint to establish femoral head acetabulum fit. The pelvic radiograph may be used to examine the general anatomy of the pelvis and hip joints, giving additional details for diagnosing hip dysplasia. For a dog with hip dysplasia, physical therapy exercises to improve joint flexion might be part of a treatment plan to maintain mobility and reduce discomfort. The most frequent surgical procedures are DPOs, which stand for double or triple pelvic osteotomies, osteotomy of the femoral head, and theraphylaxis with hip replacement. An alternative option for treating hip dysplasia can be lifestyle modification. Hip dysplasia is a genetic disease that is affected by diet, exercise, growth rate, muscle mass, and hormones. Similar to humans, we may not be able to change our genes, but our diet, or lack thereof, and lifestyle may have a significant influence to the outcome. We are our pet's best chance to better health and quality of life. Nutritional deficits can impact how hip dysplasia develops. To enhance overall joint health while minimizing hip dysplasia, a well-balanced diet rich in minerals is needed. An unbalanced calcium-phosphorus ratio can affect bone mineralization, compromising hip joint growth. Vitamin D deficiency can lead to inadequate calcium absorption, which can lead to weak bones and joints. A diet lacking omega-3 fatty acids can lead to joint inflammation, aggravating the symptoms. Trace mineral deficiencies, such as copper, zinc, and magnesium, have been linked to bone abnormalities and the development of hip dysplasia. Controlling rapid growth and keeping a healthy weight is important because any excess weight adds strain on the joints, which can contribute to hip dysplasia. Dogs with hip dysplasia often lead long, full lives, especially with treatment. Treatment options and lifestyle changes can be made to keep your dog comfortable well into old age.